Hey, everybody. So I have to admit that today's question isn't coming from any one person, but it's a question that I come across so often in OET writing life class. And it's this: what loses the most marks in OET writing? Now, that's both a tough question and an easy one. So let's start with the tough. It's tough because what do you mean by the most marks? Do you mean losing marks the most often or the biggest proportion? If you're talking about proportion, remember the criteria purpose is worth 3 marks, whilst the other 5 criteria, which is content, conciseness and clarity, organization, genre and style, and language, are each worth 7 marks. So, technically speaking, purpose has the lowest proportion of marks to lose for you. However, please remember that when there's an issue in your writing, it often has a knock on effect. In other words, it doesn't just affect one criteria, not the others. So, for example, if your sentence structure is poor, it will not only affect language, but maybe your purpose statement, understanding what it is, clarity, your overall tone, genre, and style. Okay, so it's not a cut and dry um, mathematical formula. Now, however, it's easy to say the kinds of things that will impact your letter the most and most negatively. And I'm just going by the ones that I have come across after years and years of doing this. First of all, repeatedly poor sentence structure so that the reader is distracted, strained, or confused. Now, notice I say repeatedly. What I mean is 1 or 2 errors, it's not a big deal. However, if you're doing it so often, every sentence, every paragraph, what happens is the reader is distracted by how you say things rather than engaging with the patient's concerns. So that's a problem. The next is a strain to read. Remember, in real life, your readers are busy. They don't have time to sit down and read your letter 4 or 5 times trying to figure out what you're trying to say. So what I like to tease my students and say is, if that crease appears between my brow when I am reading your letter, you got a problem. Okay? The second area that can seriously affect your marks is poor organization of ideas. And this is often because of this dependence on templates. By templates, I mean when it comes to the body of your letter, the patient information. By template, I mean that many candidates learn that you are supposed to always write this first, always write that second, always write that third. And this, if you come across a case note that's a bit more challenging, could tell the examiner that, maybe this candidate actually is not understanding the case notes or the real purpose this letter is serving. So, for example, you can have one set of case notes where the medical information, the physical condition of the patient is the most important. You prioritize that, and social information is less important. But you can have another letter where the social information is in fact critical, and the medical information, the physical condition of the patient, or is a little bit less so. So try not to have that idea of always, always, always. Think critically. The next area is poor purpose statements that leave the reader unsure of what they're even supposed to do, what's important in this patient, which is a nice question. What's important in this patient? Okay. Um, so that lack of clarity, that lack of understanding is a problem because remember, again, in real life, your readers are busy. I like to tell my students, get to the point. I got things to do. I got 60 patients in the waiting room. Okay. And number 4, putting in every bit of information because you are unsure what is relevant. And this is because OET is not only testing your writing skills, they're testing your reading comprehension. And if you put in everything, what are you telling them? That you don't really understand what's going on. Okay? So these, I would say, are my top 4 for losing the most marks.